my mask off if you could just be stay as far as possible, and I'll put it back on. So good afternoon, everyone. It is great to have you here in this very humble building that serves so many patients, especially the vulnerable communities. So on behalf of Star Purdue, who couldn't be here today, who's the chairman of our board, and the rest of our board, I want to welcome you here this afternoon. We're specifically thankful for our elected officials, and this is the second time the governor has so willingly come to join us. One, the opening of the field hospital, and then, of course, today. And our dear mayor has done the same, but he brought somebody special, so that's why this would be the best press conference yet. I want you to meet Mrs. Marty Kemp, and I'll just have to say to you, we have something in common in this community. Our First Lady for Bibb County has taken human trafficking as one of the key issues that she would embrace, and we have partnered with her. And so the kinship between Bibb County and the state is incredible when it comes to the effort against human trafficking. So we're very thankful to you for that. And thank you for putting your mask on. I'm going to check if anybody doesn't have a mask. Everybody has their mask. So we want to stay COVID safe. That's very important. We're thrilled today to announce to you a virtual care option. We call it virtual care delivery system. Now, some other areas may call it virtual hospital, but we're going to call this the virtual care delivery system. We're excited about this because it will bring healthcare to the far-flung areas of the community, but equally important, provide expedient access to many of our patients who continue to be hesitant to get expedient care. So we believe in the right care at the right place at the right time, and of course we believe in the right price, right? So when we put that all together, we're so excited about the fact that we're going to be embracing this. Let me just take price out of the context immediately. When we do this virtual care visits, there will be no facility fee that will be earned by the hospital. It's only a physician fee. So that's really important for you to know. This is not one of those new products that we're trying to commoditize for the purposes of commercialization. We have one purpose and one purpose alone, and that is how do we give expedient access? How do we make sure that we diagnose, treat, and care for the patients in a comprehensive way virtually? As you know, our capacity relaxes and wanes depending on what's going on. But irrespective whether it's COVID or not, we need to be prepared for healthcare for all, which is truly the Atrium platform. About a year and a half ago, we joined the Atrium, and in joining them, one of the key provisions and value proposition is the ability to bring virtual care to this community. And you've heard me say that so many times. They're one of the key leaders in virtual care in the United States. So the portability of that modality, especially during COVID-19, is going to be tested beyond all others. One important notable, I think, here to remember is that today, during this COVID-19 situation, Atrium Health has seen 13,000 patients in their virtual hospital concept, which we're calling virtual care delivery system. So it's very important for you to get a sense of why this is very, very important to us. This is one of the select platforms in the state of Georgia, and so we thought it'd be great to have the governor here and the mayor here to begin to vicariously experience what this concept is all about, so that we can have this emulated across the state, and it could be one that would be available for all patients. Given our geographic dispersity and how far things are from each other, having a virtual care option gives us an opportunity to access patients faster, but also allows patients to have easy access. Our typical patients, when we really think about typical patients, are not really COVID-19 patients. We are one of level 5 trauma hospitals, level 1 trauma hospitals in the state. So we see patients from close to 50 counties. We're a tertiary teaching hospital, so the referral is coming here from different parts of Central and South Georgia. So we're very proud to have that designation, but equally important, very accountable in terms of our responsibility to the community to do the right thing and give them the right care when it's needed. So without much explanation and introduction, I'm going to introduce Dr. Sandy Duke, who's the Chief Clinical Officer for Navicent Health, who will give you a context and the framework of this virtual health program, followed by Dr. Dean Kindler, who is our Senior Vice President responsible for our physician group, where the application of this is going to be done and is currently being practiced. Then I will close it down and there will be a demo of this virtual care hospital by Dr. Patel. Dr. Patel is there somewhere. Dr. Patel, why don't you join the group over here? So they know who to follow when you start doing the demo. When the demo goes bad, then you're on your own. So with that, Dr. Duke.
Thank you, Dr. Saunders. So when we started this journey about a year and a half ago with the integration with our partner in Charlotte, Atrium Health, we made a commitment to this community that we would embrace virtual care to increase access to much needed services throughout Georgia. Virtual care is something that we've embraced for years. We saw an acceleration of the adoption of virtual care with the COVID pandemic. And there are several areas that virtual care has improved the quality of what we deliver here in Georgia. The first is with virtual behavioral health. Virtual behavioral health applies virtual care for much needed mental health services. We've also rolled out virtual patient observer in the acute care setting for patients with dementia and who are at fall risk. And then most recently, virtual critical care. And we've expanded ICU services to Navicent Health Baldwin and brought ICU service for the first time to Monroe County Hospital and Peach County Hospital. And I'm excited today to talk to you about the virtual care delivery system, which, as Dr. Saunders shared, is our analog for the virtual hospital that Charlotte rolled out in March. The goal being, again, let's increase access for our patients. And so what we've targeted are those with mild to moderate disease, and we admit them to our virtual care delivery system. We can then care for those patients, round on them daily, and monitor them for worsening of their symptoms. We also see it as a possibility to discharge patients earlier from the hospital, again, driving access within the system. So we see this as a unique opportunity that we are perfectly positioned because of our collaboration with Atrium to provide to Georgians throughout Central and South Georgia. So we're very excited about that. I'd like to introduce now Dean Kindler, who's going to talk a little bit more about how we've operationalized that.
Thank you, Dr. Duke. We're very excited to be able to bring Atrium Health's virtual care delivery system to Macon and to Navicent patients. I think the real cornerstone to care is the relationship that physicians have to their patients and patients have with their care team, their nurses and whatnot. And the virtual care delivery system allows us to emulate the inpatient setting with the patient convalescing at home. Key part will be criteria. So as we look at patients both coming to the emergency center and those that are already in the hospital, that they fulfill criteria clinically driven and decided by physicians to meet standards to be able to have their convalescence at home. We will send them home with kits that are provided to them. Those kits will have blood pressure monitor, pulse oximetry, in other words, a way to monitor their oxygen levels, and also a thermometer. Along with that, they'll be logging at home their vital signs and discussing each day with a care team that rounds on them, much like would happen in the hospital, with nursing touching base with them each day, with physicians rounding and writing orders for those patients each day, and being able to monitor and trend, just as we do in the hospital, their care for both improvement and for worsening, should that happen. It also allows us to remain connected to the Navicent system so that if patients are not doing well, we already have them plugged in with our care teams in the hospital to allow for easy movement both directions. And so we really believe that this can add to the care that patients in this community have during these challenging times with COVID and really elevate the care that we can provide to a broader range of patients and to the community at home as whole. With that, this has been a very important collaborative work between teams. Those teams include our Charlotte partners in Atrium Health, who have been instrumental in helping guide us through the implementation of this, and care teams here within the Navicent Health Physician Group, the Family Medicine Academic Practice, the Family Health Center, where you are at right now, which provides immeasurable importance to our community to provide care, along with our healthy communities and obviously the strong commitment of the executive team here at Navicent. With that, I want to particularly call out Dr. Patel, who is our medical director for the virtual care delivery system, who will be providing a demonstration of our care today. And with that, I'll turn things back to Dr. Saunders.
So it's now my pleasure to introduce to you two very important people. While they're in the political space, they're actually in the advocacy space. First is Dr. Mayor Rickert, who's been an incredible supporter of Navicent Health and a dear friend. And then, of course, I know that you'll be introducing the governor, but I want to go ahead and take this moment to thank you. And I said this to him privately every time we call his office, and that's every day, morning, lunch, and dinner. And we're asking for this, and we're asking for this. Julie, pop your head in here so they can see, because she's the messenger. I said, Julie, call them for this. There's never, not once, a time when they say we can't do that. It's always, we're on it. And it's never faltered. So I can't thank you enough for that incredible support, because we feel it here, we feel it in this region. And I want everybody to know that that's very visible in our community. And so, Mayor?
Thank you, Dr. Saunders. I appreciate the opportunity to say just a few words, and I'm certainly aware of the fact you didn't come here to hear me talk, but instead to hear our governor. So I'll be very brief indeed, and just say that as I became mayor of Macon, elected in 2007, one of the things that I really wanted Macon to do was be the hub city of the Middle Georgia region, because so much is being regionalized now. And healthcare is certainly one of those things. And I am delighted and proud of this collaborative effort that Navicent has had with Atrium to bring this new technology to us. So just another feather in our cap, and I'm delighted with that. And now to the main reason that I'm here is to introduce somebody that needs no introduction. Now, what do you do with that? Well, you try to be especially brief with this and say he is a true Georgian, he's a native of Athens, a graduate of the University of Georgia, a successful businessman in agribusiness, financial services, and real estate, so certainly well-rounded. Served in the state Senate for 4 years, served as our Secretary of State for 8 years, and was elected 83rd governor of Georgia in 2018. Please help me welcome to Macon and Bibb County the First Lady of Georgia and her husband, Brian Kemp.
I think you got A+ on that, Mayor. Well, I certainly appreciate that, Mayor, and I appreciate your steady leadership for a long time here in the consolidated government of Macon, Bibb County. So thank you for your service and your support and friendship and just really all you've been doing to do great things, quite honestly, in Macon and Middle Georgia. And I want to thank NIMFA too and the whole team at Navicent for really all they've done. We had a great visit here looking at the mobile pods a while back. Just fantastic. And I know back then things were a lot different than they were now, but we did the same thing we did then. We thanked all of these hardworking folks that are on the front lines and in the support roles and everywhere else, facilities like this, the main hospital and so on, that Georgians don't get to see every day, but you're out there on the front lines of that fight. We know that, and we are very grateful for how hard you all have been working, and quite honestly, what a great job you have been doing, learning about the virus, learning how to treat people and get people well and getting them home. And we're just grateful for that. Marty and I have been on the road today, and we're glad to be certainly in Macon, but I also want to take a moment just to thank the public health team under the leadership of Dr. Renee Haynes for their efforts in the community as well. A lot of times people don't really think about the public health workers that are out there every day doing testing and contact tracing and many other things, and we just appreciate their hard work. They are literally doing record things right now when it comes to testing. We've literally tested tens of thousands of Georgians since the start of the pandemic, and we're certainly appreciative of that. We announced another partnership this morning. Before we came to Macon, Dr. Toomey and the First Lady and I joined U.S. Surgeon General Jerome Adams. He was back in Georgia, where we announced a mega testing site at the Atlanta airport. Clayton County right now has over a 20% positive rate. So certainly an area that we need to target. We appreciate the partnership that the federal government has working with the state, but also a lot of local governments. Chairman Turner and Chairman Pitts were there from the Clayton and Fulton County Commission chairs were with us. We had great support and collaboration with the Atlanta airport. John Selden was there this morning, and it was just it was a great event. And we are starting to see encouraging signs in our statewide fight against COVID-19. But I can assure you that we are not taking our foot off the gas, and I know that you aren't here either, because we can't do that right now. But for the first time since July 18th, our total COVID hospitalizations are below 3,000, and that was down to about 2,850 yesterday. That number earlier this morning was fairly close to that, but there were still quite a few hospitals that had to report today, so that number is probably going to change. But regardless, on Tuesday, we were at 3,113, and yesterday we were at 2,850. So a pretty significant drop, and it's not, in every community. I know this community is still very busy, but in others, especially in the metro Atlanta area, we're starting to see some good movement there on the strains on our hospitals. Our percent of positivity continues to decline as well, and our testing capacity continues to increase. Both of those things are good. Our cases have been relatively flat, perhaps slightly trending downward, and that's why we're not declaring victory. We got to continue to keep our foot on the gas, be vigilant, and continue everywhere we go, whether we're talking about testing or virtual health. We got to keep encourage people, wear your mask, wash your hands, socially distance yourself, and follow the guidance that we have in the existing executive orders that we've worked so hard with our public health officials to get out, to help our businesses be able to reopen and help our public be able to deal with this pandemic. So I want to continue to urge all folks in Middle Georgia to continue to do that. Wear your mask, socially distance, wash your hands, and follow the guidance that we have. If we do that, we can flatten the curve and stop the spread and help your friends at the hospital out by keeping them from being so busy. These we know are proven tools in our fight. It's what we call the public health toolkit. And, one of the things that we have really focused on, probably myself as much as anything, and what I follow more than any amount of data, is our hospital capacity. I mean, that is literally where the rubber meets the road. Like the number of cases, the number of tests we do in a day, we watch all those numbers as well. But the thing that really hits home, that worries me the most, is hospital bed capacity, because we want to have a bed for every single Georgian that needs it, not just for COVID, but for other health outcomes as well. And I think that's something that has gotten lost to a lot of people. Our hospital surge capacity plan is built to allow, hospitals like this one to be able to continue to do other critical services for the people of Middle Georgia, whether you need a knee replacement, heart valves, whatever, cancer screenings, cancer treatments. Georgians need to feel safe being able to do that, and you can. And that is why we've worked so hard to put the temporary pods in that the state did here, to open the World Congress Center site, working with Piedmont, their new tower, to open early to give us additional bed capacity so we can take less severe COVID patients and have another bed for them that free up beds in the hospital for more severe care or elective surgeries and things of that nature, because it's good for our citizens, but it's also good for the financial viability of the hospital. And that is something we have to continue to get out to Georgians. So I want to encourage people, do not be afraid. Don't have reservations. Call your medical provider, call your doctor, and talk to them if there's something that you need to have done. Do not put that off. That can be a bad health outcome for you. So we've been working very hard in regards to that. I also wanted to just thank everybody for the treatment options that we have. The states work very hard to distribute remdesivir, and I know that along with plasma treatments, steroid treatments, the physical caring of the patients, that the medical community that are working day out in facilities like here in Macon, people are just having better health outcomes, and we're very grateful for that as well. And all of these things combined are continuing to help us win this fight. And we know it's going to be a little bit longer battle, but we got to keep battling every day. So I want to continue to encourage people to wear their mask, socially distance, wash your hands, and follow the existing guidance that we have. And if we do that, I know that we're going to be better off tomorrow than we are today, and we'll be better off in 2 or 3 months than we are right now. And we will continue to work hard to not only protect lives, but also to protect livelihoods. We're in a 2-battle war right now. Have been in a battle for a long time with COVID-19, but we're also in a battle too to make sure that our economy recovers and that people's livelihoods aren't ruined by this virus as well. And so I just want to thank everyone for having us today. I'm really excited to see this virtual healthcare. It's going to be one of the things that I was telling Dr. Saunders, that, and as bad as the pandemic is, there's been a lot of good things that we've learned, and things that in some ways we've almost been forced into doing that are going to be really good for us long term. They're going to make the hospital more efficient. They're going to provide better care for people that can't or don't want to get out. And there's just a lot of good things like that you almost, it's hard celebrating in a time like this. I mean, there's people that have been losing their lives, and their families are devastated by this. And it's almost hard to acknowledge good things sometimes, but this is a good thing here today. It's going to be a good thing today, but it's going to be good for many years to come, I believe. And I just want to thank you all for your leadership. Thank you very much.
I just want to affirm our commitment to you, working alongside with you and you, Mayor, to fight this incredible pandemic, and I think we will get there. So we are going to ask, while the governor's here, before we do the tour, let me tell you what's going to happen. We're going to take a group picture of all the people that are in lab coats, all our physicians and clinicians, along with the governor and the mayor. And then after that, we are going to, Dr. Patel will be giving a tour to the governor and the mayor and the team from the governor's office. Then following that will be a tour of the virtual care platform for the journalists. So if you could all just, I guess I'm the only one that don't have a mask. If I can just put my mask on, and then we can, Cindy, you